It's Good Day New Mexico with Casey Messer.
It's no big surprise that most people really hate going to the dentist. But guys, listen to this. Your dentist can actually become your very best friend. Here with more, Dr. James Mattingly. Dr. James, good to see you.
Nice to meet you.
No one has said you're my BFF just yet, but it's bound to happen one of these days, I think, right?
Well, anything's possible, right? So we're talking about dental emergencies. The American Dental Association estimates that over 2 million people go to the ER each year for dental-related emergencies.
2 million.
Which is huge, right?
Yeah.
But from a company called Medscape, we also have a statistic saying that only 67% of those people get their problem resolved.
Oh, wow.
So there's a disconnect,
Okay.
So we're going to talk a little bit about Tiger Woods.
Yes, all right. Yeah, that guy, Tiger, he recently had a dental emergency.
Yeah, Tiger actually was hit in the face from a TV cameraman's camera accidentally.
I mean, he had to have been pretty close to
Yeah,
Tiger. Like, he
right?
should have known, bound to like turn around or something.
Broke his tooth off,
man.
sheared it straight off. I guarantee you, shortly after that happened, the dentist was Tiger's best friend.
Oh, yeah. You know what? He probably said it. You're absolutely right. So do you have a little demonstration of kind of what happened?
Okay. Let's talk quick first about the most common dental emergencies.
Okay, yeah. What are some of
All
those?
right. Toothache related to an abscess of your nerve, a chipped or broken tooth, a lost filling or a lost crown, something wedged between your teeth or your gums.
Had that happen a time or two. Popcorn, right?
That'll do
Some
it.
Seeds too. Strawberry seeds.
They're brutal.
Yeah.
And the last one is a traumatic injury that actually causes the tooth to be avulsed from the mouth, okay?
Okay, so what will cause that? When the whole tooth will fall?
All right, so that's part of my formula for this. If you get caught in an emergency, remember this simple formula. It's called the FAST formula.
All right, quick.
F-A-S-T. F, find your dentist or a dentist immediately. Do an online search. Try to avoid the ER whenever possible. Okay, get to a dentist. The A stands for either Advil or Aleve. This is what we want to take. They help with pain and swelling. Tylenol helps with maybe some pain, but doesn't do anything for swelling.
Oh, okay.
Okay. The S in our formula stands for swelling. In addition to these, we want to use a cold compress. Okay. We don't want heat. Okay. We want cold. Get a bag of ice or get one of these packs where you hit it and put it against the cheek. Cold is what we want for swelling. The last part of the formula is T for tooth, as you mentioned. Sometimes a traumatic injury will actually cause your tooth to come out.
That whole thing?
The whole thing.
Oh, man.
Okay, here's what you want to do if that happens, as scary as it is. You want to pick the tooth up by the crown of the tooth, not by the root.
How come not the root?
Because we want the root to stay as disinfected as possible. So just rinse it under water. Don't scrub it off or anything. And actually try, if you can, to reinsert gently.
That sounds painful.
No, really, gently. If you can get it back in there. If you can't, then here's what you do. You put this in a Ziploc bag of milk. Or, yeah, and if you don't have milk, water and a pinch of salt, and get to your dentist. Studies show if we can get this tooth back in within 30 minutes, there's a really good chance that it'll reattach to the bone.
All right, I guess we don't have the traffic problem. We can probably get there in 30 minutes to our dentist.
So there's our FAST formula, and I promise you, if you follow this formula, then the dentist will be your best friend.
Yes. Real quick before we go, I have this dream all the time. Maybe you know what this dream means. When your teeth are falling out, what does that mean in your
good
dream?
grief.
That's a whole nother segment, right?
I've had it. What does that tell you?
I think it means we are a very, I don't know. I've looked it up a few times. Dr. James, good to see you.
Nice meeting you.
For more information, you can go online. It's jimmydds.com or give him a call, 925-933-5446.